I got to do that for 12 hours, 4 days a week. I swear not a day go by where I don't think that I done got coronavirus because I can't breathe and my chest be hurting. They don't understand.
I got bronchitis.
What's going on, y'all? Listen, welcome back. I know y'all ain't seen me in a while, but it is extremely hard, extremely hard to try to get these videos out, try to get this content, working 4 days a week and only having, 4, 5, 6, 7, yeah, only having 3 days off. And my 3 days off is before, let's say, I work Sunday, work Tuesday, Monday, Tuesday, off Wednesday, Thursday, Friday, and then work Saturday. I just be tired. I be dead tired. I just be trying to sit down, be trying to put my mind in other places and do other things and have to get other things done. So I'm sorry for the hold up. But listen, I am in my 5th week. I've officially completed half of my contract, which is exciting. So we only got 3 more weeks to go after this week, and then I'll be done. So we're pretty much halfway through. I feel like I done seen it all. I done it all. Haven't completely conquered New York yet, but I'm ready to go. I'm ready to go. I'm not built for New York, especially in these climates. I can't get out. I'm stuck in the house, and people, it's just a lot. But what I can say is, in my first half, in the first month that I've been here, I've learned so much and I've seen so much with this COVID stuff. I can bring you guys a better picture. So basically what I'm seeing when people come in with COVID is they are in ARDS. So that is acute respiratory distress syndrome. They're coming in, they're either tachypnic, breathing extremely fast, shortness of breath, really can't catch their breath. They're not oxygenating very well. So they're coming in with O2 sats between less than 90. So they're coming in with O2 sats of 89 and less. I mean, I've seen one as low as 65, and the desired O2 saturation is between 90 and 100. They're coming in with flu-like symptoms, of course, mostly like a cough or chest pain, and then once we work them up, send off their lab work, they won't have an increased white blood cell count, which will show infection, but they will have on their chest x-ray, it will show pneumonia, and it'll be a pretty bad pneumonia that is causing these symptoms of respiratory distress. It is a thin line between stabilizing them with either a non-rebreather mask and getting that O2 saturation up, or intubating them and putting them on a ventilator. It's either one of those two options. Sometimes you have your few cases where patients will come in and they'll still be able to breathe still be able to manage on nasal cannula or even on room air, and that's for your fairly healthy individuals. But a lot of time it's either ventilation or they need a lot of oxygen. So I'm seeing that. You're seeing a lot of people, like I said, with the pneumonia, once things have gotten too far and it's kind of already taken its course, you're seeing people once they are intubated and they become ICU players, we'll put a Foley in them, and a Foley is basically putting a tube in their urethra so that their urine is drained out, and we don't got to keep changing them. But we're seeing like very fast renal failure because they're not having any urinary output at all. And once the kidneys go, that kind of gives you that sign that they're not going to be here too long, or they may not make it. So that's pretty much what I'm seeing with COVID-19 patients. They are extremely critical, so it could fall anywhere. You can have your patients coming in who just can't breathe. You got your patients coming in with a cough and have been shortness of breath on exertion or like walking upstairs, and they really haven't wondered why. It's not anything that will concern you, but once you go and check it out, you see that you have pneumonia. You've been walking around with pneumonia, and it's because of the viral disease. So that's what I'm seeing, and that was pretty much within I want to say the first 2 or 3 weeks. let's just say the first 2 weeks is when, things were really bad. And since then, I can honestly say there has been a drastic decrease in census. People are still coming in with COVID, and we're still having our patients that are coming in critically ill and pretty much having to code them, or they come in dead, half dead, and have been revived in the field, and then we revive them. Then we set them up and they crash on us again, and we still having that flow of patients in. But as far as the mass people all in the ER at once that I explained in my first week, I haven't seen that since the first mid-second week. So which is a good sign, but it's still very prevalent, and there's still high death cases that are occurring currently. Now, one thing I will say, since I just found out that pretty much census is low everywhere, so a lot of places are ending contracts early. Keep y'all fingers crossed, because I'm just trying to make it to the end of the month. But I know all the day shift nurses at my facilities contracts got canceled, which is not uncommon in travel nursing, but for it to be on such short notice is kind of concerning, because I just feel like so many resources in that well is running dry with so many facilities that they just pretty much can't afford it, and they've exhausted all their resources. Now that scares me, because I keep hearing things on the news that there's going to be a second wave, and this second wave is going to come with the flu. So I feel like facilities are trying to prepare and get ready for that, so they're ending agency and travel nurses now, just in order to bring them back later. With the census being so low, it's given me a lot more time to focus and see how long, and see the process of how COVID-19 takes course through the body, because ICU beds are still full. ICU units are still full and jam-packed, so a lot of the ICU patients are still boarding downstairs, still having to take care of highly critical and multiple acute patients at one time, just not as much, and it kind of gives me an idea into what it's like to be an ICU nurse. And I felt like I've learned so much in just a month. I feel like, honestly, I've learned more in a month of working here in New York than I've learned in my first 2 years of nursing. I don't know why. I feel like I was very task oriented in the ER, and in prior ERs, because we weren't getting many acute patients, or we were getting getting an acute patient here and there, and they just didn't fall in my hands, or if it fell in my hands, it was for a short period of time. But now I'm getting to hang all these drips and getting to do these different things and see what's going on. I will say one thing that is still kind of pulling on my heartstrings is that there's still a no visitor policy at the facility. So patients are coming in by themselves, they're lonely, and that's really hitting me hard, because having to introduce myself to my patient, and all they see is a mask on my face and a shield, and me covered up head to toe. They're scared. They think they either have COVID or going to get it while they're there. Very anxious, and because they by themselves, they don't have anyone to to really hold on to, or to really comfort them. Since starting this contract, I have opened up my heart a lot. I feel like working in the ER, you become jaded to a lot of feelings, because you see a lot of death on a daily basis. You see a lot of sick people. People get a lot of bad news on a daily basis. So you just have to have tough skin and toughen up. But in these moments where people, can't see their families, or people are calling in to get updates on their families, it's like, you gotta have that, sense of humility. You gotta be able to be a nurse and be caring, and kind of put work to the side. There's been plenty of times and situations where I've been at work and, after I was in my feelings one day at the work, not in my feelings, but I was feeling really good. I had a good day at work. And I just kind of want to give you guys a sense into, where my head is, and why don't y'all just check this? Just listen to it. Hold on, let me take my mask off. With all the negativity surrounding New York right now and the COVID-19 situation, I've been trying to find the silver lining to it all to kind of bring some fulfillment to myself and get something out of this. And I think last night I had that aha moment. So, because of COVID-19, all hospitals aren't permitting any visitors to see their families. And I understand that people that are coming into the facility or who are coming in through, EMS and ambulance, they're not coming with their families. Their families can't meet them at the hospital. So they don't know what's going on. They're left out. And I feel like people fear the unknown the most, especially now that their families are in the hospital. They feel like they're more at risk. They're wondering if they have the virus or scared that they will get the virus. And it's little things such as communication between the nurse and the family members. Now, I see it a lot. Nursing is one of the most compassionate professions ever. But after being in the profession for so long, people lose that compassion. And I found what brings me the most satisfaction is being able to communicate with family members on the status and the plan of care of their family because they can't be there to help them. Talking to several family members last night, they just thanked me so much. Thanked me for calling them back when their family member was either transported out or was transferred to the unit. Just little things, updating them on what the plan of care is, or what their diagnosis is, or what their lab work say, or if their swabs came back positive for COVID, if they came back negative. Little things like that. They thank me so much. They bless me and wish the best of me. And you could just hear the sincerity and, and just gratefulness that they have, because a lot of people will be on the phone with them and just shoo them off or not give them any information. So now they're just wondering what's going on. And I just feel bad for the people that, try to get that information and come to find out later that their family member had died. And, even if that was inevitable, an update on the patient status, on how they were doing, so that mentally they could just get adjusted to the situation. So I feel like that's really important as a nurse, to communicate with the family members during times like this, because it's not just hard on us, it's hard on them as well, because nobody wants to die alone, nobody wants to be by themselves, and nobody wants their family member to die by themselves, especially somebody that's so important to you. So I feel like that's the most satisfaction that I get working as a nurse during this COVID-19 crisis in New York. And it's real, because people's family members are dying. People are dying by themselves. Usually, death is inevitable, but we expect for our loved ones to be around us. We don't expect to be by ourselves and lonely. And just seeing that is kind of sad, because taking your last breaths, or with your last breaths, you don't want to be by yourself. You want to see familiar faces before you go, I feel. So that's just sad. I had one situation that, I haven't had a situation in the ER where I've truly been affected or have gotten emotional since like seeing my first death when I was a new grad. But here, I had one patient. She was really young. She had a lot of comorbidities, other predisposing factors prior to COVID, that she was sick. She was young, I want to say maybe about 29, 30, but she didn't look it. And you could just see that, she was fighting. She came in When I got her at change of shift, she wasn't intubated, or I think they were putting in like a arterial line in her, and then shortly after they intubated her because she was just lethargic, not responsive, and just having a hard time breathing on her own, and it was going to get to a point where her body was going to shut down on her. So we intubated her, and when we intubated her, based on like the ventilation settings, you know, you could just tell that her body was still fighting. She was still fighting to stay alive, and it was like that throughout the entire night. I mean, her blood pressure was pretty much normal intensive, and it was just her heart rate was extremely like tachycardic. I mean, like 140s, 150s the entire night. It didn't matter what we did. All the drips that we gave her to bring her heart rate down, it just wouldn't work. I remember I gave her I can't remember, this was probably earlier in the week, but it didn't matter what we did, we could not bring her heart rate down, and it was just like 140s, 150s the entire night. I remember I think the lowest that I got it and I was excited about was I got her down to I want to say about 130, 135 after giving her like 5 of labetalol, and 10 minutes after I gave her another 5 per the doctor's orders, and I got her down low, but it just shot right back up, and it was like that the whole night. But you know, she was stabilized, she was stable, she was just super tachycardic, but she was oxygenating well. Another, she didn't have any urine output that entire night, which took me back and kind of made me, you know, pretty much ping like, okay, this has to be associated with COVID and patients that are coming in and that are pretty much one of the reasons they're dying, because their kidneys not working, they become acidotic, you know, become septic, and different things like that start to kind of have that trickle down effect. But then, you know, she survived through the entire night with me, gave report, and went home, went to sleep. I worked the next day. I came back. Come to find out, she coded 3 times. I want to say about an hour and a half, 2 hours after I left. She coded 3 times, and that took me back, because I'm like, you know, that could have been during my shift. You know, I could have been fighting with her the entire night, but you know, she was holding on with me, but you know, couldn't really hold much longer. And when I went back into the room, because I didn't have that assignment, but when I went back into there to just like check on her, she, you know, I remember when I initially left her after giving a report, you know, you could just feel a certain energy in the room. You could just feel, in a sense, life, because she was fighting. But when I returned back to that room, there was just a stillness in the room. It was just no energy, no vibrations. It was just a stillness. You could literally feel death just in the atmosphere, and it gave me chills. Like, you know, it kind of took me back, because I was like, you know, I fought with this lady the entire night trying to, you know, keep her alive, and she's still alive right now, but she's gone. You know, I know she's gone. You just, her eyes just look different. Her body just had changed so much, because she had been put through so much trauma in those 3 codes. You know, they lost her 3 times, pretty much. That's what I'm saying. So they had to do chest compressions and give all these different medications for people that don't know what coding is. But you know, that situation just kind of took me back, and I feel like that's another situation I just won't never forget. Like, just feeling a stillness in a room that I was once in and felt energy in. So that's pretty much how it's been. Things are getting better. My anxiety is decreasing, because you know, the flow of things, and you know, because it's not as much work to do. My anxiety is decreasing. Things are getting better. Getting to really focus on my patients. I want to say my patient ratios now average from about 5 to 7 patients a night, which is still above that 4-to-1 ratio, but it's definitely more manageable. And I can really say, if I couldn't if I wasn't good at time management before, I'm a beast now, because taking care of 7 patients and making sure all their medications are given on time, or if I get a new medication or new lab work, just getting to find my way and get better at things that I wasn't as good at with 4 patients. But now if I have 4 patients, I'm gonna be kicked back with my feet up, you know what I'm saying? So that's pretty much been my first half of my contract. And then, things are looking on the brighter side, and are looking better, because they won't be needing us. They won't be needing travel nurses or agency nurses in the upcoming months. That just says things are slowly returning back to normal. But don't fret, all right? Don't get all excited. It's not the time yet. It's not the time. So y'all still stay home. Make sure y'all wear y'all mask. You know what I'm saying? They opening things back up outside, but don't fall for it. You know what I'm saying? Make sure you protect yourself. What's more important to you, or what's more important to your family. Times like this show you what really matters and what's really important, and you need to realize what's important. Buying clothes, things at the mall, going to the beaches. No. Make a beach out in the back of your yard. Get some sand, get a little pool, get yourself right. But you know what I'm saying, stay bunkered down. We're gonna get through this together, and make sure y'all like, comment, subscribe. I'll see y'all in the upcoming weeks with more videos. I done been through some things here in New York, so I got some funny videos for y'all. So you just make sure y'all stay tuned, all right? And I'll see y'all next time.